think we'll get started here. It's 1:30. So hello, everyone, and welcome to the Healing Community Study Learning Collaborative. My name is Lisa Romley, and I'm the Education Program Coordinator for the HEAL Study. We are here today to learn how workplace policies and best practices can transform an environment into making it a recovery-friendly work environment. And today's panelists have experience in that area. Before we get started with the session, I just have some housekeeping items I need to review. This session is being recorded. We are offering 1 CE credit, and that has been approved to physicians, pharmacists, nurses, social workers, and licensed drug and alcohol counselors. We also ask that you stay, and I'm going to give you some information at the end of the session on how to get those CE credits. We ask that you stay mute during the session when you're not speaking. It just helps reduce those echoes and extraneous noises. And if you do have questions, and we do welcome your questions, use the raise hand feature, which is you find at the bottom of your screen. You can click on that and then click on the raise hand, or just type your questions in the chat box and they'll read them sometime during the session. To announce financial disclosure, Beth Davisson does not have any. Beth Kuhn's spouse does have a financial relationship. He's employed by and holds stock in a health-related company. Our practice gaps that we are addressing today is employers are unaware of all the best practices for workplace policies in relation to supporting employees who are in recovery from addiction. And the educational needs that we'll be addressing is providing education of the KTEP program, which supports employees in recovery and benefits to employer who agree to partner with this program. Our learning objectives today, we're going to discuss the benefits of the KTEP program, discuss best practices and workplace policies that support a recovery-friendly work environment, and we're going to talk about the benefits of implementing a workplace naloxone program. And hopefully then at the end of the session, you'll be able to implement best practices and workplace recovery-friendly policies, and also recognize the value of hiring employees that are in recovery. So I'm pleased to introduce our moderator for today's session, Dr. Sharon Walsh. She's the professor of behavioral science, pharmacology, and pharmaceutical science and psychiatry. She's the director of the Center for Drug and Alcohol Research and the principal investigator for the NIH Healing Community Study. So I am going to turn it over to Sharon here for the introductions.
Thank you, Lisa. We have a question in the chat from Melissa Handy asking if anybody else is having trouble hearing, that it's garbled. Can folks let us know? Speak up or raise your hand. You can hear me fine, Beth?
Yes, I can hear well.
Look through the gallery and see if anybody else. Okay, thank you for everybody that's responding. I appreciate that. Hopefully it'll clear up for Melissa. So it's a great pleasure to be here today, and I welcome you all. I'm very happy to have you all participating. Our hope for this session really is to have a robust discussion. We'll start with the panelist introductions, and but then it would be really wonderful to have the opportunity for the audience to ask as many questions as we can get through in the time that's allowed, and you can just put those directly into the chat, and I will try to monitor that carefully. So we have 4 panelists with us today, and I'm going to introduce each just very briefly. They all have done quite a bit, and so I'm not going to spend too much time on their introductions because I want you to know a little bit about them, but then I'm going to give each of them an opportunity to tell you who they are and how they've become interested in working in this area of transformational employment. So our first panelist is Beth Davisson, who is a friend and colleague of mine. She's currently the Senior Vice President at the Kentucky Chamber of Commerce. She leads the Kentucky Chamber Foundation, advocating on behalf of business. And Beth was appointed by Governor Andy Beshear to the Executive Committee for the Kentucky Workforce Innovation Board. And Beth always has a lot of really interesting contributions to make. So our next panelist is Beth Kuhn. So you'll hear me refer to them as Beth D and Beth K to differentiate as we go through some questions and answers. Beth Kuhn has over 30 years of experience creating and implementing innovative workforce, human service, and health programs. She's worked within the state. She collaborates between business, government, and nonprofit partners, and she's a principal at Stonegate Strategies, which is a consultant group that focuses on developing futuristic workforce development strategies across sectors and organizations. Our third panelist is Susan McGilligan. She is the operations manager at the Hilton Inn in Danville, Kentucky, which is, as many of you know, in Boyle County, and is one of our Healing Communities Wave 1 partners. She's been a foster parent for 15 years and has adopted 2 foster children, and she volunteers at New Hope Food Pantry. And our fourth panelist is Holly Ross. She is a business owner. She owns Miss Bubbles Cleaning Service and has for 2 years, serving the Ashland area, which is Boyd County, another one of our Wave 1 communities in the Healing Community Study. Her cleaning service does residential and commercial cleaning, and she's got an associate's degree in business. And so with that, what I'd like to do is give each of the panelists an opportunity just to give us a little background about who they are and how they became interested in this topic. And then we'll move on to a discussion period. So let's start with Beth Davisson.
Thank you so much, Dr. Walsh. It's a real honor to be on this stage today. You know, at the Kentucky Chamber, we were so excited those years ago when the UK and the Healing Community Study came about to our state, and we knew how needed it was and how impactful it would be. So it's really an honor to be here today and being a part of it on this stage as we've worked together. So we'll talk a little bit about, you know, people often think, well, the chamber, it's a why are you all so involved in recovery? But really, it's also a workforce issue in Kentucky, and we'll get into more of that later. You know, in Kentucky, we miss out on a lot of our citizens that suffer from this disease and aren't easily welcomed back into the workforce. We see a lot of barriers. On a personal note, I'm also in recovery. So I'm a business executive who also is approaching 8 years of sobriety from alcoholism and understand the barriers that it takes to get over a disease like this. And we started on this work back in 2018. I can see Van Ingram is on the call, our state drug czar, if you will, from the Office of Drug Control Policy. Back then it was Beth, he and I, leaders from CORE, the Cabinet for Health and Family Services, really working to try to understand how businesses can play an active role in the recovery of our citizens. When our state has been impacted like it has with the amount of opioids that flooded our Commonwealth, everyone had to step up and play a role. And so what we've really done together and what we'll talk about through the course of this program with efforts like KTEP is really get the business community understanding the role that they can play when it comes to treatment, prevention, and recovery. Just grateful to be with our state partners on this. And it's fun to have Beth Kuhn back because she was really instrumental to get it off the ground, and to see Van, who is just our public-private partner in this effort.
Thank you, Beth. And I just want to say that through the partnership between the state and the State Chamber of Commerce, from my perspective, I think that Kentucky is one of the most forward-thinking states in the country on this issue and is really helping to lead the way, as we have done in a number of other areas related to substance use disorders and their treatment. All right, thank you. Beth K.
Good afternoon, everyone. I'm really excited to be here for a couple of the reasons that Sharon and Beth D already touched on. But the piece of my background that I think I'll mention the most is my time in state government in Kentucky, because both as workforce commissioner and then I crossed over and spent time in the Cabinet for Health and Family Services in the Secretary's office working on the connection between workforce policy and health and human services. I was then and remain passionate about how critical that connection is. And so this conversation is a piece of that. And I think this moment is a piece of that. I know we all are familiar with Martin Luther King's I Have a Dream speech, and we talk about I have a dream. But that is also when he used the term, the fierce urgency of now. And this week is when we announced the number of overdose deaths we had in the prior year. And so we all sit in this Zoom meeting with that. And we all, so on the addiction and recovery side, we have that fact and what COVID threw at us and what fentanyl throws at us. And then on the other side of what we want to bring into this conversation, we have the incredible disruption in employment and workforce right now. I have been at this over 30 years, as Sharon's read of my bio said. I have never seen a time when there has been more change in such a fast period by employers around workforce policy. Never. And that those two forces coming together give everyone on this Zoom and the 10 people you know and the 10 people they know an extraordinary opportunity to make change for people in recovery, for organizations, for employment, for all of it. And so I just feel privileged to be in this conversation on this day, November 18th, 2021, and to issue a challenge to all of us about what that means. And so I think we'll talk about it. We're privileged to have real live employers doing real life change. And I think the burden and the challenge and the opportunity is on all of us to make something of that. So really looking forward to the conversation.
Thank you, Beth, so much for those inspiring words and also for your commitment. And we are privileged today to have employers with us who have taken that next step. And I think that they will really add richness to the conversation because we can talk about initiatives and we can talk about programs and guidances and things like that. But that real lived experience of actually doing it and walking the walk, I think is a really valuable one to hear about as well. So Susan, do you want to give a little bit more of an introduction about yourself?
I can do that. I'm Susan McGilligan, and I was a foster parent for 15 years. I have adopted two biracial children. At the age of 43, my son was 2 days old when I brought him home from the hospital. He was born addicted, alcohol, marijuana, tobacco, and cocaine in his system. His sister was born 13 months later. She was a little sicker and stayed in the hospital a little bit longer when I brought her home because the mom had huffed paint with her. Over the next 3 years before our adoptions were final, I got to know her quite well, and seeing her addiction and seeing her spiral downhill several times during those 3 years was heart-wrenching for me. And that was really kind of my first introduction to that because I had, pretty much led a sheltered life up until then. So it kind of opened my eyes and broadened my horizons. As an employer, I have a staff of about 23 people, and about half of them are recovering. We struggle every day. Sometimes we come in the office and we cry. We all cry, and we cry together. We pray together, and we do our best to encourage each other. If someone's having a hard time, we do our best to encourage them and to lift them up. I'll send them off to a meeting, anything to help them. We've had successes and we've had some failures. So we can talk about that a little bit later, I think. So thank you for inviting me to do this.
Thank you so much. Thank you for being here. And Holly?
Hi, I'm Holly Ross. I'm in the Ashland Boyd County District, like they told you at the beginning. Miss Bubbles Cleaning Service. I've been the owner of it, and I started about 2 years ago. I'm also out of recovery. It's been about 8-9 years. when I came home, I was working an $8 an hour job, got offered to decorate doctors' houses and stuff for Christmas, become an interior designer. That's how I got into cleaning. I used that power that I had and also started employing women out of recovery and addiction to help them become employed because it's hard for them to find employment. So I just used that outlet that I had to help employ other women like me who was unable to have jobs and who still need to support their family. And like Susan said, we're a family, we're a team, we have our ups, we have our downs, we support each other. They're my employees, but they're my friends and I'm their friend. So we talk about stuff. If you're having a bad day, we just kind of work through that to help you stay on your recovery path. And that's what I do. I help women find job placement. And if I don't have a job, I know Miss Hanley's on here. And if I don't have a placement for you, I'm also in BNI. It's like 36 business owners. I actually send her referrals from other businesses that would hire them too to help get more people jobs. So that's
Excellent.
what I do.
Thank you. We'll have to talk about that a little bit more later. So why don't we kick it off with just understanding a little bit more about some of the things that are in place to support employers. So I'm going to start by asking Beth D just to talk about the Kentucky Transformational Employment Program, or KTEP, and tell us, how did it get started? I think Beth K has some thoughts on that. You can tag team however you like on this. And how do people enroll and what does it actually provide?
Yes, thank you. And I think Holly just kind of hit on a big point with workforce. There is a business case to be made with why this work with KTEP is so important. So right now, Kentucky has the third smallest workforce in the country. We are second behind just West Virginia and Mississippi. So everyone except Mississippi and our border states are kicking our tails when it comes to talent. Employers are in all-out crisis when it comes to finding talent. I think Beth K had even alluded to, she's never seen it this bad. We have produced our most recent report out of the Kentucky Chamber Foundation that's titled The Kentucky's Workforce Crisis, 20 Years in the Making. And in it, we really look to the reasons why. Of course, we talk about childcare, skills alignment, baby boomers. We talk about all the things, but one of the things we really talk about a lot at the Kentucky Chamber is workforce participation, specifically when it comes to substance use disorder in Kentucky. And so when we look at that number, you have to understand, why would we come up with something at KTEP? So we saw dramatic improvements back in 2019 when we started these type of programs. The numbers were going in the right way. Kentucky had gone from 48th to 42nd in the nation. We were getting people back to work. I know our health outcomes around substance use disorder were also ticking in the right direction. But we all know that we hit a 49% increase in overdose death rate since the top of the pandemic. And so when we look at that of course it's a terrible fact that we're losing mothers, fathers, generations will be impacted. And when you look at the workforce numbers, that's 25 to 55,000 working age adults that could be working today. 1 out of every 3 jobs could be filled with those that have died from this terrible disease. And so how KTEP came about years ago, we started really looking at what are solutions that work, how can employers play a more viable role. And so we had worked with the Kentucky Healthcare Collaborative, CORE, Kentucky Opioid Response Effort, the Office of Drug Control Policy, the Cabinet for Health and Family Services years ago to really work on legislation. This is the policy side of the Chamber House. I work on the foundation side. So our policy team worked with these partners to really develop this legislation that would give legal liability protection to employers. So if they are considering talent that comes in and fails a drug screen, or if they have an employee that fails a drug screen, instead of just firing them, they can now refer them on to treatment and have the protections to do so. We love copy and paste because why not? We looked at the state of Indiana and basically copied their bill and I think made it better. And so that was the legislation that got passed. And then once it got passed and the regs went through, our teams with, again, that same group of partners at CORE and KHC and the Office of Drug Control Policy and CHFS came together to implement the program. And now, so we have good policy that's not just sitting collecting dust on a shelf. With these groups, we have an army of a team that is out there actively working with employers to get this implemented. And it's been implemented for the past couple months. I see the director of our workforce recovery program, Morgan Kirk, is on the call. And she's really the one that's running this with Ryan Bowman on the day-to-day with those other partners that I mentioned.
Thank you, Beth. And is it possible that you would be able to put a link or share the link to the most recent report that you talked about? You could either put it into the chat if you have it here with you.
Yes, absolutely.
You can share it with the participants so that anybody wants to refer to it. That would be great.
I will do that for you, Dr. Walsh, and everybody on the call. And I should have mentioned when I got on the call, Dr. Walsh, I was like, great to be here. She's like, well, I mean, turnabout's fair play. She sets on every stage for us. So absolutely glad to be here. And we'll put that in the chat.
You got to pull those favors in, when you get the opportunity.
Oh, we owe you 10 more, I'm sure. Thanks.
Thank you. So Beth, Kay, do you want to give some context? So this is the history about why we developed the program, but in your opening comments, you said this is the worst that it's ever been. Can you kind of give us a little bit more color commentary about what that looks like?
I think what's interesting about this time, Sharon, is it's on both sides, right? And so it's sort of the perfect storm in both negative and in opportunity ways. And so I think on the epidemic side, right, we know that there's a lot of people in this virtual room who that's their field and their knowledge, and we got hit by curveballs in addition to pandemics. And on the employment side, and Beth D alluded to this, it's not temporary, right? So we have a lot of people who are wishing that, oh, we can just have things go back to normal, right? We have this terrible talent dearth that Beth D alluded to. We have very weak labor force participation. It's not a temporary thing. If you're a workforce nerd, as am I, it's demographically driven. And so it's not a COVID short-term emergency that's going to rebound. It's a demographically driven. We have a lot of retirees who have decided to exit, and our age demographic is going to make us short of workers for the longer term, just as one example. And so where I think we really have an opportunity here is to look at talent and develop talent in our brothers and sisters who have this disease, who have been bypassed and who haven't been creatively supported like a KTAP, like some of the other programs that we've sort of continuously developed. I've been in Kentucky 10 years. And in that time, we've had other efforts that have led to where we are in the policy realm that Beth D just talked about, and with KTAP. And the last sort of color commentary comment that I'll make, and this is one that we've volleyed back and forth, the Beths and other partners. It's a very intentional choice to call this transformational employment. It's not an accident. And there's a lot of terminology that predates this around second chance employment and fair chance employment, all of which are important and good assets. But the fact of the matter is that people in recovery sometimes need more than 2 tries. And so when we started to work with employers around some of our initiatives, and we started using terms like second chance, we found that to be maybe not a setup for success, right? Because maybe it's more than 2 tries. And even when you start to talk about fair chance, it's almost like you're doing the person a favor. And there's a little bit of a reality here where the balance of power in the world today is the employers need you, person in recovery, as much as you need them. And so the idea of transformational is we are here together today, and we are here in KTEP transforming the life of the person in recovery through a job and an occupation, and transforming the business with better, smarter, more modern policies and practices like what KTEP is helping those businesses do. And so that transformational idea, I think, is a piece of this that we came to over time. We didn't start there, but it's where we belong in 2021 for all the reasons that we're talking about.
Thank you for that, Beth. I think you are really pointing to kind of a fundamental issue in the field that touches all of this, right? Is just about the words that we choose to use and how we change, how we are framing things and how we need to change the conversation. So it's very interesting because there are, I know, a lot of businesses that are really hurting for employees, but at the same time turning away a lot of people who could be great employees, right? And those barriers for people that are in recovery could be, you know, a urine drug test. It could be a past, you know, criminal charge, things like that. I work for a pretty conservative employer. I don't know if you've ever heard of the University of Kentucky, but, you know, trying to launch this healing community study where we wanted to make certain that we had plenty of people on our team who had lived experience and were in recovery and would be really like the most important boots on the ground to be touching the lives of people in our communities where we're trying to really transform what they're doing and at the same time save their life because of this overdose crisis. It's a challenge to change that conversation, right, in a bureaucracy. And so I think having, you know, a supportive external structure where you're codifying and like it's okay to think a little bit differently. It's okay to have these conversations is critically important. So given like that side of it, where we have employers that are rigid and maybe not yet forward thinking because we haven't yet changed their hearts and minds, which is what we're always working on. I'm curious to hear from our other two panelists about whether they have trouble finding people to hire into their positions when they're very open to bringing people in who are in recovery. So can we hear from maybe Holly first?
So when I started my business, it was just me and one other girl. I could not find employees nowhere. And then I met Miss Hanley. Miss Hanley works for the probation department in Ashland, and she does job placement. So I spoke with her and I was like, hey, I need employees. I have this business. It's hard for me to find employees. I have all these contracts with businesses going on. Not only do we do the commercial, we have houses during the day. And she's like, great. So she's like, I'll screen people. She'll talk to people, screen the people. And she's like, and I'll send them along your information. Well, I now have 12 employees and they're my best employees ever. They're all recovery. It was on a whim. I was really nervous about it. I was like, I'm going in doctors' houses. We're cleaning dental offices. That's a big, that could cause someone to relapse or whatever they have to do. So, so each girl that I hired, I worked with them as a unit with me. Mm-hmm. So, I hired the girls. I went on the whim. I hired the girls, and I've had the best employees. My business has grown so much. And I think it's really important. You may meet somebody and you may put them to work like, okay, well, they don't work their work ethic. You know what I'm saying? They don't have really good work ethic. But every person that you hire out of recovery or whoever you hire, they have strong points. You just have to find their strong point. I had a lady call me. She was 67. She's like, I need a job. And I'm like, oh my gosh, she can't move furniture or nothing. Now I own a laundry. Like I was nervous. I was like, now I own a laundry business. So guess what she does every day, all day. There's a job and a place you can put all these people in. Yes, there is a risk, so make sure you're bonded and insured. And I would personally suggest working with each individual that you hire, work with them on a one-to-one basis. That way you get to know them. Because usually you can tell when people have, are they recovering Or are they still doing the same thing? You know, late all the time. There's always an excuse. They don't feel like, you have to watch for all those signs. And it's tiring sometimes because you're like, you know, because you have to screen everybody. But
Sure.
I must say, my business has grown a lot, and it's because of this program and hiring people out of recovery. We have 45 houses and 15 commercial properties. We have a
Wow.
floor cleaning. I mean, we do dentist office, pharmacies. And you know what? And now I'm to the point where I've had these ladies so long, and they do such a good job, and I train them. I can let them go off on their own. I have like one girl over commercial properties as inspector, then I have another girl over a house. And I've never had no issues by giving these ladies a chance. And before, I was working like 12, 13 hours by myself, and me taking this leap and it actually working out. I hope other businesses actually do it, because
Yeah.
once people run that background check and you know, society the way it is, no one wants to work. So if you would just go out on a whim and hire these people, not only do they want to work, because it gives them a piece of self-fulfillment, it gives them some motivation, it prevents them from relapsing because they have something to look forward to, get up and look forward to every day. And it just helps their self-esteem, you know?
Yeah.
And the girls and I, they are my employees, but you're only as good as your hands. So they're a friend as well. I have some girls that don't have a car. I get up at 4:45 in the morning, take my son to daycare, and I'll pick these ladies up and I'll drop them from house to house to house. That way they have a job, because that's what they need for themselves.
Right.
They just need something like that.
Yeah. Yeah. Thank you. And before moving off this topic, let me ask Susan about hiring and finding employees.
Well, since the pandemic, pre-pandemic, if I hired 2 people a year, that was a lot for us. But since pandemic, I've probably, it's like every payday, it's like, oh my gosh, I've got 5 terminations and 5 hires. I'll hire 6 people and 5 quit. But it's been kind of hard to keep people and to keep them motivated, especially in this industry and in because you know, cleaning. I understand, Holly. It's not an easy job. I firmly believe that most people. I don't believe that people have weaknesses. I agree with Holly. You look at their strong points. People have needs. We all have needs.
Okay.
And I think at some point in our lives, we're all recovering from something. And so I take that very, very personally. When I had the foster children, and I had about 125 come through my home in 15 years, and to see the struggle of those parents, and some of those parents struggling to find jobs and stuff, and this just, it was just part of, I think, the plan that God had for my life to get me to where I am today. So with Holly, we screen these people. They come from their Shepherd's House here. We've had several employees from there. I currently have a couple, and you just work with them. You help them. I have 2 employees that have married each other, and we had a wedding, and we had a wedding in the meeting room and decorated it and had fun. They're both recovering. They both are coming up on 1-year sobriety for both of them. They've advanced here, and we encourage each other. We just encourage them every day, and they have proven themselves because they're both now. They started as housekeepers, and both are now. Chas is now my assistant housekeeper, and her husband Brandon is now my maintenance fellow. So that it's worked well. Anything we can do to help them, we do.
That's great. Thank you. So I do want to, because Melissa was mentioned, and I think that she's on the call with us, Melissa Hanley. Are you with us, Melissa?
Yes, I ended up having to sign on with my iPhone for some reason. I couldn't get audio to work on my computer.
Oh, that's okay. Would you mind just saying a little bit about what your role is and what you're doing in the community?
Yes, ma'am. Thank you for asking. I'm a reentry employment program administrator. I work with the individuals as they are released from the courts, the jails, the prisons, on helping them overcome barriers they face. One of the things that we help them with is employment. Holly's business has been a blessing. I was so excited when she came to me that day because a lot of employers don't want to give convicted felons a chance. And she has been more than willing to work with my clients, and it makes a huge difference in their lives. I have another company out of Louisa. The guy had just gotten out of jail and he started his own construction business, and it has taken off. So it's exciting to see people getting out, overcoming their past and moving forward. I had an employer call me yesterday. He had never hired a convicted felon or anybody on substance abuse, and he was willing to take a chance. So he called me and he said, I'm willing to hire this guy if you can bond him for me. I said, absolutely, yes. And I'm talking about the federal bond, the insurance. So that was exciting to get another employer on board. But that's what we do. We get excited for them, and they'll call me up and they'll say, hey, guess what? I got my license back. Give them the motivation that they need. I know Goodwill in Moorhead area, they have the Cars to Work program. I wish we could get something like that here because transportation is a major barrier for a lot of the folks.
Sure.
But now we have the Department of Corrections, and the Department of Transportation has that pilot program. Well, it's not a pilot program now, it's actually a program where we will provide that transportation for them. And that has really helped overcome barriers.
Thank you so much for sharing that with us. And let me just ask if Van is still on. He's got his still picture up, so I don't know if he's still sitting in his chair or not. I think there he is. So the development of these positions for reentry coordination, that was very intentional. Isn't that supported by your office?
That is actually a core funded program. Dr. Marks out of her shop.
Okay.
Started with 5 and grew to 10. And it's Dr. Marks will tell you it's one of the best programs we've got.
That's great to hear. So if we have somebody, I mean, it's good that Melissa's making connections in her community to some of the business owners, but is there a place where, say, someone lives in another community that's not near Melissa? How do they find out who the reentry coordinators are if they want to connect with them? Say they have positions available. Is there a listing on the state website or something like that? That's to you, Van.
I'm gonna refer that to Sarah Johnson. I think Sarah's on the call.
Sarah is on this call too. Sarah, can you talk about that a little bit?
Sure. I don't actually oversee reentry, but I am aware that there is information available on the Department of Corrections website. So we try to make our website as user-friendly as possible to the general public. And there is a subsection for reentry that includes pretty robust information that's available to the general public.
Okay. Thank you so much, Sarah. I appreciate it. And just so everybody knows, one risk of being on a Zoom with me is that, I may just randomly call on you, even if you're not on the panel, because a lot of us go way back. So thank you all for your contributions.
And
So
Sharon, can I add one thing to that? And I pose a similar risk when I'm on Zoom. I think back to the talent pipeline on this topic. I think the REPAs, there's lots of people, the good news is working on this now. And so continuing to connect them with each other on calls like this, but in other ways, we're upping our game of expertise, right? So
Right.
Those REPAs and the folks that Beth D has at the chamber under KTAP, and the people that EKSEP has under the Strategic Initiative of Transformational Employment, the Job Entry and Retention Support Specialists, we got people on this now. And we did, and I think they will still and can still, and Van's part of this and others, come together and help employers say, what's the state of the art on policy? What's the state of the art on some of these questions that we'll have today and that will percolate after this meeting so that they connect the dots on behalf of the business growth objective and the recovery objective. They're mutually reinforcing if we let that be true.
Right, right. So I don't know everybody that's listening in. And so I don't know what your interest is in this, whether you're an employer or someone who's been employed and in recovery. Or so I really want to encourage people to put any questions that they have in the chat so that the participants can get as much out of this hour or so that we have together. So I don't want you to be shy about that. I have plenty of questions that I can keep asking. And I think what I'm going to do is just thinking about an employer. Let's just take, for example, an anonymous biggest university in Kentucky wants to transform the way that they're employing people, and they want to come to KTEP. What kind of services can they get? What kind of education can they get? What can they expect? And then is there support after, they've gotten the kind of initial education? What kind of support is available to them on an ongoing basis? And that's to either Beth.
Beth D, why don't you start and then I'll back clean up. How's that?
Sure. I think we really have to think about too, 'cause I feel like we have a lot on the call that are really supporting this population or reaching out to employers to get them to make a different step and take an action step where they are hiring those that are coming out of treatment or incarceration that are or might have those backgrounds where they need that fair chance. And I think really looking at the business case for why, on top of there being a workforce shortage, and we've seen it in some of the stories that were shared from Susan and Holly today, that people in recovery really make for incredibly productive employees. And one of the goals we all had when we started our workforce recovery work together in linking job outcomes is that what we wanted to transform was employers treating individuals that have this disease of substance use disorder or opioid use disorder in the same way that they would treat somebody with heart disease or cancer or diabetes. So when I was active in my recovery, there was no way I was going to my HR office and asking for help. That was taboo. There was a stigma associated with it. And so what happens is so many people are one bad decision away from something really bad happening. But individuals that suffer from other chronic lifelong conditions, such as diabetes, they could have full access to that HR office to go in and ask for help and ask how to use those health benefits to get treatment. And so that's one thing we really have the resources and the tools to do, is to help understand how to lead those employer conversations. KTEP is another resource for that is available to anyone on this call, that is free due to the partnerships that we have with CORE and with the Office of Drug Control Policy and with some of our private funders. But the program brings the benefits to the employers. It allows businesses to welcome what we really call the untapped talent pool. And by doing this, employers really are broadening their workforce populations. And so what they get if an employer is ready to sign up for this program is they can get our team to handhold them through it every step of the way. We've worked with some real experts out of the Kentucky Indiana Healthcare Collaborative that have given us step-by-step instruction, and we have trained the trainer, and we can go into businesses now and walk them through every step of how you implement this program, so that when you have that employee that comes in, fails a drug screen, and instead of just firing them and dismissing them, you can link them to treatment, allow them to go on to treatment if they choose, allow them to complete their treatment program and come back, and their job would still be available for them. And there's a whole lot that goes into that A to Z from an employer to be able to make that work, but we're available and we have all those resources for them to lean on to really implement this from all perspectives in the workplace.
And, I think what I would just add to that, Sharon, for the unnamed institution thereof, or any other employer, small or large, right? There's a whole bunch of policies and practices in workplaces and employers that roll up into a culture. And I think what we've got now, and you alluded to it earlier, Kentucky's best in class in this. They can turn to KTAP for help, for templates and tools on how to make your policies right for now. And it starts with the policy on, do you do pre-employment drug screens or not? And do you do background checks or not? Now that world is really changing. And interestingly enough, what's the data on should you? So all of this is a work in progress, but you can get help to sort that out. You know, the pre-employment drug screen turns out might have been a stigma-driven thing as much as it was a data-driven thing. So let's talk about that. That could be its whole own meeting, by the way, so I'll stop there. So drug screening, then Beth D alluded to it. What do you do if you have a positive test? That's where KTEP really shines. We used to fire you. That was it, 0 tolerance. Well, that's not current best practice anymore. Well, what does said institution need to do then? Here's the best thing that you can do in order to retain that employee if they so choose. It still puts the choice in their hands to seek treatment. What about your employee benefits? What's best in class for employee benefits in this era? And so it takes employers large and small, any size can play. You can be Holly's Cleaning Company and you can be a large university with lots of employees and still tap into policy guidance, benefits information, tools and resources, and get better at treating this like what it is and not what it was, which is a shut door and a lost talent pool and a stigmatized thing that really isn't representative of where we are now. And so I think there's actually a lot of depth in Kentucky to what we can give to employers.
Thank you. Yeah, I mean, in both of your comments, you talked about some of what we all know are the initial barriers, right? Like the background check, the urine screen at the point of determining whether or not somebody is employable. And obviously we're making progress there, but we've got a lot of work to do still, but that feels like one piece of it to me. But then once you actually get the person on board, then you have other things that, and you're talking about like having the best benefits plans, things like that. What kind of guidance are you giving to employers around whether or not they have a right to or should be connected with someone's treatment provider if the person is an employee and that person is still in treatment?
I think the really good news is that in Kentucky, we have a lot of ways you can do that and a lot of support for that through these kinds of programs and partnerships we're talking about. And the bottom line is there can be really good and safe and productive relationships between employers and treatment providers that used to be kind of like a scary space, right?
Yeah.
And so I think it depends on the employer, depends on the community, depends on the treatment provider, and you can reach out to KTEP, to your workforce boards, to your REPAs. Like, people know we have a network of support to help you sort out how that treatment provider relationship might work. Right. And we have best practice. I was on the KTEP website today that tells you, how do you get the appropriate privacy protections in place? How do you do important work to make sure that that employee and that treatment provider are doing their best work? So yes, there's a good way to do that. And yes, that's exactly the space that this initiative is working in, because we have a really good treatment provider environment in Kentucky, and we have the awesome chamber, and we have all these other partners who have made that viable to do work with employers.
Yeah, I think that the privacy issue is complicated and there are a lot of things to think about. And I think about people who have been in treatment and don't and want to pay out of pocket because they don't want their employer to even know that they're in treatment because they'll, the insurance claims will be coming through. Those are the kinds of things that
Yes.
are just really
And I
uncomfortable,
think
right?
Sharon and Beth D alluded to this. I think we're trying to make progress on that, right?
Yeah.
And it still should be that employee's choice and that employer's choice. And maybe they're not going to be able to stay together because they might not be able to cross that privacy issue, right? And maybe that employee's going to leave as a result. But it used to be that Beth D in her situation couldn't go to HR, and she sure as heck would have gone to HR if she had diabetes.
Right.
And now at least we're saying, no, it's okay that you get treatment for this. It's an illness, and it's okay that we know you have treatment. And maybe not everyone's going to get there, and maybe not every employer is going to be there, but it's sure as heck is better than it used to be. And we want it to be better still.
Yeah. Thank you. So Renee Dotson has a question in the chat. Renee, do you want me to read it or do you just want to say it out loud yourself? You're on camera.
Sure. I
warned you. I warned you.
It's okay. It's what I'm here for. So I work for Lexington Rescue Mission and I work in the employment division, and we advocate for our clients to be able to get that transformational employment. And so trying to build those relationships with the employers. But I've had employers that I will burn the bridge with, per se, where I'll convince them that they should hire a certain individual, and then say a couple weeks or a month later, that individual quit, either due to relapse or they just find something else better. And then they don't want to work with me anymore for that, because it could happen. So like burn the bridge. So how do I continue to build those relationships? Because I believe our individuals deserve that second chance, deserve that opportunity. And so I want to continue to keep advocating. Is there things that I can do to help improve that?
Yeah, I might add, it's such a trick. There's 2 points that I think that I could answer to help address that. One, it's how we talk about that with employers. So we've always been really intentional around saying transformational or fair chance. We don't say second chance, because sometimes we all know it takes a third, a fourth, a fifth, a sixth chance. And so really updating the language with the business community on it might take a couple tries. And so don't give up. And I will say too, as you update kind of that language and your relationship with the employers, really using that language. And I will also, I wanted to mention this earlier and I didn't, on our website, there is a system that we have in a tool platform called Talent Hub. And in the last year and a half, we've been able to recruit 23,000 second fair chance. Sorry, look at me. I'm learning too. Fair chance jobs with Kentucky employers opening their door. And Renee, we've definitely ran into the same thing where sometimes it just doesn't work out. I'm sure a lot of our partners on the call could empathize with that as well. So that's one thing, is just keep trying and think about changing the language. I think the second one, and this is the bigger question that I still don't have an answer for, and I don't think I'm going to be the one to come up with it. There's way smarter people than me that should be answering this question. But it's the point when somebody's really ready to go to work. What is that point? And I don't, the business community, I don't think we know that. I think we can help be a partner and address that. But that's always been there is this point in sobriety that you're really ready to go on. And no disease is the same with this disease, of course. And so it's always trying to understand, when is that client really ready for the pressure of a job, and what type of job? Because there's varying degrees of work, and there's varying degrees of recovery, and there's varying degrees of this illness. So it's a very complex, and I'm not giving you an answer, but I think it's something we should all be thinking about, is how are we as a state coming up with a formula, which is a really bad word, but a formula or some sort of system that helps us all understand this is a person within the recovery that they're ready to go to work, especially when you have business people like me that don't know the world like you all do, trying to help and do the best we can. That's high.
And what can the employer do, right? Beth D and Renee and everyone, like own your half says in that case, and I'd be interested in what Holly and Susan have to add to this. In that scenario that you describe, if a person leaves, how might we have employed that person differently? And how might we do it differently the next time so that the Hilton could have, what are Susan's best practices or Holly's that keep that person who's on the bubble of ready employed? What are the employment practices that we're learning that make that tipping point tip to yes? So I don't know if Susan or Holly have anything to add, but I think there's an employer piece of changing and learning in all this too.
I, for one, think that when I have a success, I think back on that success and why we're so successful with this person and it didn't work with this person. And so during my interviewing processes, I may change my my way of thinking, my way of asking questions during the employment intersections. I don't do drug tests anymore when people come in, because 9 times out of 10, the average Joe is they're just not gonna pass it these days. So I don't do that. I go on how I feel about the person and how we interact. And I also let the employees know that, my door stays open. It's closed right now because the time clock's right outside my office and it's about time for people to start going home for the day and coming in to work. But my door is always open. And we have, we've had a couple of people that have come in that are not quite ready for that commitment of work. Their court order says they have to work, so they find a job and they come to work and they really don't want to be here. And so we work a little bit harder with that person to try and turn that around and say, what can we do to help you be a little bit more committed to your job? What skills can we try and teach you that can help you be successful later on in life? Those are some of the things that we do. We've had some people come in that have triggered other people, and everyone on my staff knows that if you get a trigger today, you call me. And I've had to come back to work to help that person with the trigger that has been triggered because someone else is talking about using on the property. I just changed my perspective with those people and see what we can do to help them.
I have a follow-up with this one, Dr. Walsh, too. Susan just made me think about that. And by the way, Susan, you are my new hero. Did you foster 125 kids? I feel like she said that, and then it just, wow. Kudos to you, and thank you so much for doing that for our state.
November is National Adoption Month, too, so that in mind.
Yeah, when you said 125 children you fostered, I said, well, Susan just became my new hero. That's really beautiful. But thinking about that, employers are dealing with such retention issues, and Susan made up so many good points about how it really does make you become a better leader. And so not only am I in recovery, but the chamber is also a fair chance transformational employer, and we hire from this population as well. And what I've noticed is when I lead to them, I lead the rest of my team better too. And so when you're taking care of that whole person, you really are becoming not a better person yourself, but a better leader. And in a world where we can't find talent to save our lives, retention is a language that employers really speak and really care about. So using that with, this taking care of the health of your employees is a good thing. It's good for your bottom line. Fair chance hiring is good for your bottom line. And the statistics actually show it. And there's some other stats that come from the National Safety Council that will show you that individuals that are in recovery are more productive than your average citizen, and they actually retain longer than your average citizen. So there's a big business case or conversation for businesses on not only does it make us a better leader, but it really does pay in the long run.
Thank you for adding that. I also want to reflect on something that was embedded in Renee's description of the problem. And she said that, employers have felt burned because she placed somebody there and then they left maybe for something better. That's what people do. That doesn't have anything to do with whether they're in recovery or not. That, like, we say hallelujah when that happens, that somebody gets a better job, right? It doesn't matter. And so, but it makes me think about that lens, that the stigma surrounding substance use disorders and people in recovery, particularly in maybe a less than comfortable environment, maybe an employer that is new to employing people that are in recovery, that everything like, oh, that they're not a good worker or, whatever. Yeah, I can tell you that I have a lot of employees through all the work that we do at the university. And there just are some people that just are not good workers. It doesn't have anything to do with drug use. I can assure you that. Or they're not the sharpest knife in the drawer, or there's all kinds of other things that you encounter as an employer, right? But I do think that there's a tendency to automatically assume that it has something to do with their history or something to do with relapse or, and I think maybe reframing some of that might be helpful too. People that are in recovery are not perfect, but no one else is. And so I think that it's really, really important that people don't have those expectations, or maybe expectations that are even higher than they would for somebody that wasn't in recovery.
And Sharon, just to add to that, not just reframe, but can we please measure? And so I think the data on this is really important. Beth D talked about National Safety Council data, but I just saw a fascinating study from one employer. They actually did a randomized control study on whether pre-employment drug screening actually correlated with performance problems and terminations after hiring, and they found zero correlation. So they actually, so here we are, you're at UK, we've got a bunch of smart people on this meeting. Let's make sure that I think that lens that you talk about is real. I think the expectation or the bias, whatever you want to call it, is real. But now with the amount of urgency that we have both on the recovery and addiction side and on the employment and workplace side, let's get some metrics in place and say people are leaving because they leave. They're not leaving because they're in recovery. Or no, there is no value proposition or no data to support pre-employment drug screening anymore, because now here's the third study that says it doesn't correlate with performance or retention. And so we got to get better at using data in this employment space the way we have in treatment and hold ourselves to a higher standard, because I think that will sell, back to Renee's question, I think that will sell better with employers than maybe our previous ways that didn't have that data to support them.
I could not agree more with you. And, as a scientist, I love data and I love data-driven decision-making. And, but I'm not sure that this kind of data is that readily available, right? So this is what this is some of the initiatives
we should study some.
We need to study it more. We need to publicize the studies more, share them, make them into consumable bites for people that are not, data nerds.
And make the employment and recovery intersection a space to study and measure and report on, because the promise for both business economic growth and for recovery and reduction of overdoses is real.
Yeah. So let me ask a slightly different question about incentivizing employers to participate. So Beth, I think that you and I had some conversation way back when about developing an academy for for employers, and the idea that people could somehow get certified as a recovery friendly employer, or I'm not sure what terminology you were using. I'm wondering whether or not you can tell us, is there precedent for programs like that? And if you're still working on that here in Kentucky, can you tell us about where that is?
Yeah, we are still dreaming it up. We've found ways to do it for now. So kind of the Band-Aid, it's not the bigger dream that I think we've all had since the beginning, which is to really certify and celebrate. But we're figuring the celebration part out. So on the Talent Hub website, I put it in the chat. We celebrate employers with kind of a badge of honor that are transformational or fair chance employers that post jobs. So any of those 22,000 jobs that have been posted on there in the past year and a half, those employers got kind of that badge of honor. The bigger dream is, we run at the Kentucky Chamber. We've always seen this as kind of compared to how we run best places to work. But every employer in Kentucky wants that award, and only 100 companies get it, and it's super competitive every year. But we want to dream that big that employers really, that we figure out some way to measure, to in quantify and qualify employers that are fair chance or transformational, and that we figure that out through some sort of guided course of study through certification. We're still dreaming that up. Beth Kay and I sat on a plane once, I think home from Seattle, and really put some pen to paper on it once. And I think we were almost there. And then, other bodies of work and pressing issues like COVID or something like that came about. We have seen another state, New Hampshire. Isn't that correct, Beth? New Hampshire did a really good job at this, and they pulled something out, and I think it's run by their state government, but a really interesting program. So we're not giving up on it. It's still there. And we'd still love to do something like that. And I know Morgan Kirk, who again, I know I met referenced her earlier on the call, she's actively dreaming this up now. So we're going to figure it out. We are eventually going to figure it out.
Good. And should I assume that both Holly and Susan's businesses are on your list?
They are. I mean, Holly and Susan's businesses are just so inspiring. I've put them on a lot of lists since they've been talking, which Sharon knows that means I'm going to invite them to come speak at some of our events.
That's right. Watch out.
Well, and I just follow up to that, Sharon, and say to Holly and Susan, what'd you do it for? And I have a little bias on this that says, if you do it to grow your business, Holly was so articulate in the beginning of this meeting saying, man, it was just me. And now I got all these people, and now I got all these clients, and I'm like rocking it, right? I got this great business. That's the incentive to me. And so I want to be sure that if Beth D and I get back together and dust off our documents and say, let's do this thing, that we're incentivizing the right thing, which I think is being the best possible business that Holly and Susan can be. And that's what they're in it for. So I would say, yes, Beth D is going to invite them, but also we're going to come back to Holly and Susan and say, how do we attract businesses to do this? What's the ask? Maybe it's just you are, an awesome business for running your business so smartly to attract talent when no one else can.
Thank you. So there's a question in the chat from Patricia Parsons. What about the safety sensitive positions like truck driving or machine operations that are federally mandated under DOT for drug testing?
I will speak to that. I'm sure Holly and Susan and Beth, and I'll just be quick. For us, it's an employer choice. So employers still have the authority and the autonomy to test. And she is exactly right. There's some that's in their law books. They have no way around it. So with a program like KTEP, there is testing included. And so I just want to make that clear that even within KTEP, we recommend testing. I mean, if an employer is going out on a limb to keep a job and hold that job for that individual, should they come back, they are able, should that employer choose to test, and then that employee would have the choice to take that test. So for us, it's about choice and not making this a black and white rule across the board, because some industries and positions have standards that we cannot work around. And that's a really good example of one.
It's a business decision and business need. right? All of this stuff is. And I think what's really exciting about where KTEP has gone is it expands the policy universe to say we need to look at your testing policy and at your response policy, so that, you know, do you test and when, and what do you do when, if there's a positive, all of that. It's just expanded the whole way that employers have means within the context of what their requirements are in their industries. There's just a lot more to do and think about now. It's much smarter than it used to be, which was just no, no, no.
Right.
Mhm.
Right. So Terry Hudson has put something into the chat. Terry, can I call on you to talk about this? Because this is something that I'm not familiar with. I'd love to hear more about this.
You may, but I'm not going to show my face today.
That's okay.
So we're developing an ERN, Kentucky Employer Resource Network, where we'll actually put a success coach on the job site. So the success coach can help not only those who are in recovery, but all employees in the hopes that, you know, we can help with things that are sort of non-HR related. You know, people have trouble with making decisions when, you know, they're faced with adversity. I have folks who take jobs who have no idea how they're going to get to that job once they get the job. They buy cars they can't afford. They have childcare issues, maybe caring for an adult, you know, a senior parent. All these things are just, they're really non-HR related, but they just need someone to kind of help with community resources, you know, things that could, you know, could help them out of their situation. But just somebody to walk with them through these issues rather than the employee just saying, you know what, it's all too much, I have to quit.
Right. Yeah, that's really innovative. And you said it's really not just targeting people that are in recovery. It's really to help employees in general, right?
Correct.
Yeah. Okay. That's great. Thank you. So let me ask Holly and Susan, maybe if you can, because you both are such strong advocates and doing such great work in your communities. I'm certain, though, that you encounter a lot of resistance and you probably encounter stigma and what I often call ignorance, just kind of a lack of understanding, that a lot of people in the general public just don't really understand substance use disorders as a treatable disease, you know, and so I wonder how you cope with those things, how you have those discussions, and how much of a barrier they are for you.
So with my business, I'm a felon. I have a felony. That's how I started my business. You know, being a single mom, I was only making $8 an hour. You know, I have a college degree. I couldn't get a job because I had the stigma with me. No one would hire me. And that's why I started my own job. And then I ran into girls like me, like I was in Miss Hanley's office and there was a girl in there. She was upset, child support, you know, that she was going to go back to jail. She couldn't find a job. So I was like, cool, I can use my outlet to help her out to get a job. One of my best employees. We actually had a bid on a real estate house. I went to go do the bid. And the lady took my name down and actually Googled me. Then she told me she was only going to pay me and my employees so much dollars an hour because we were felons. You know what I'm saying? She's like, I just don't know how I feel about people being in my house. I was like, okay. So I gave her I know I'm a little probably a little bit mean, but I was like, okay, well, welcome to the neighborhood. Thanks for giving me a chance. Here's a number to another cleaning company. Well, they're like, not the best cleaning company. They probably have like half a star, but I was really upset because I thought it was so mean, you know, like it was just so, and I don't want to put my girls into a house where someone's going to say something to make them, because the way I was raised, you treat the janitor like you treat the CEO. So it doesn't matter if I'm your real estate agent or if I'm the one mopping your floors. Like, you just treat people with respect. And my girls are valuable, their time's valuable. So no one's going to treat them like that. And we were at another house and the girls were working, and I think honestly, I think the lady who owned the house had a recovery issue herself, and she got nice with the girls, and I made the girls drop everything and we left. And I didn't get paid for it. But I'm not going to let my girls get subjected to that because they don't deserve that.
Right.
Because, that's their past. Like, why would you tell them you're only going to pay them this much because they have a felony or they're out of recovery? Like, what does that have to do with their work ethic?
Nothing. Yeah, nothing.
It has absolutely nothing. And that's what's wrong with society. And the problem is today, because you won't give those people a chance, but they're the best workers that you would probably ever have. I know whenever the girls work, I get a lot of positive comments and stuff from clients, whether it be commercial properties or houses. And when I get those, I screenshot them and I send them to every girl who did that house that day. Very positive. I like to send those messages back to them. Like y'all was talking about when they're on that bubble verge where they want to work or where they don't want to work, that might actually push them into the bubble to where they want to work. Because that's a verbal incentive is sometimes more appreciative than, financial is, don't get it, that's an incentive too. But sometimes that self-esteem boost really can motivate a person to work, to want to get up and enjoy their job. So I pass along every positive information because it's not me working, it's you all working. So I'm like, yeah, the girls are great. I have a really good team. I had a real estate guy text me. We do a lot of rental properties too, like Ashland properties and stuff like that. They rent out to traveling doctors and nurses. He's like, oh my gosh, you guys are the best. This looks, you know what? I forward the message on to the girl who did it. Like, he said, you did great. Good job. Thanks so much. And, we do like Ashland Paramount Art Center. We did like a big Foxfire event. The girls were able to get backstage passes and meet. I didn't know none of the musicians, but they were they were over the moon about meeting them. So they knew who they were. They got VIP passes. There's just little incentives, and that verbal incentive is probably the biggest asset to your company to motivate these people who are on the verge of getting in that bubble to work. So
I want to come work with you.
We do positive affirmations in the morning and quotes. And I'm like, today might have been a bad day, but guess what? Also happened today. I'm just like,
that's really great. That's really great. So Susan, on the topic of stigma and how you address that when it comes up, can you just talk about that a little bit?
Well, we're kind of a closed community. Not many people know that I hire a lot of. I've had felons, and in fact, I've got a couple too that are on the staff now. But and I don't broadcast that a great deal because it's my employees' business. It's not my business who they are. It's my business to encourage them to become better than they are, and that's what we do, and that's what we're about. My employers are probably the most gracious people I've ever worked for, and I've been in this business off and on for 40 years, and they encourage me, so why won't I encourage my employees? As far as the stigma within the hotel, of course, with hotels you have a lot of drama and a lot of gossip, and I curb that. I stop it right at the beginning. And when we hire someone that is in recovery or has a record, I tell them at the hire that this is your business. If you want to share with others, that's perfectly fine. But always tell me if you have a problem or you have an issue. Then that way we can deal with it and we can help each other. And I can maybe have some resources. Being on the board to the food pantry here has really helped a lot of them because I have a lot of single working mothers. I actually have a 7-year-old that's helping mop the floor right now. I've been watching him on my cameras, and because he's had a cold and he can't go to school, but he comes here and helps his mother mop, and sometimes he cleans my office, and I'll give him $5 or something. But it's the employee's business. It's my business to help encourage and to create a team that's willing to work and wanting to work. And I know our time's running short, but I want to encourage the people that are thinking about doing this. You know, I have employees that get on their phones and have meetings with their therapists. They have court dates. I let them come in late. They meet with their therapists. They meet with their parole officers. As employers of people recovering, and I'm sure that Holly can attest to this, we have to be willing to work within their guidelines, because once they feel secure that they can do that and that we support them in that and we support them in their recovery, like with Holly's employees, they just become better employees. They become better people. They're more secure. They're more happy. And like I started saying, being on the food pantry, I meet the employees sometimes after work. Nobody has to know that I have the key to that and that I can go in and get them food to help them if they need that. That just makes for a better working environment, I think.
Thank you. So we have just a few minutes left. I would love to have any questions from the audience that you want answered before we close out. But I don't see any just now, so feel free to start typing. In the meantime, what I'm going to ask one last question, and that is that some of what we talked about borders on discrimination or is actually discrimination, right? Things like, you know, well, I'm going to pay you less because you've got some past charges. And I'm wondering, to the extent that things can be or can be legislated to encourage more recovery-friendly employment, whether or not there's any kind of legislation that's in place or under consideration in Kentucky.
We're really excited about the Recovery Ready Communities bill and what that could do. So that was passed last year. It came out of the Bright Leadership Kentucky class. Representative Adam Bowling led the way on that one, and we worked really hard on that bill as well. And that sets across like standards for access to treatment and wraparound services across the Commonwealth. So if you live somewhere in Kentucky, that you will have access to treatment. And then also when you come out, your barriers, that the idea is that the barriers will decrease and that those social determinants of health will improve because we've got requirements and standards across the state. There's a good coalition, a task force that the governor has put together on that. I said that and then I realized, well, I'm on it. So I am excited about that. That's a little self-serving. But it's a lot of people that are a lot smarter than I am on there for sure. And it's just a good, well-rounded group that'll be defining those standards and working very closely with the recovery community on that. Dr. Walsh, I'm sure they've already given you an invitation to come and chat. But I'm really excited about that, what that legislation will bring about. And I think those findings will potentially lead to more too.
Let me advocate, since you're on there. So we have an insider to advocate for connection to good treatment, not just treatment.
Yes, absolutely. Evidence-based treatment. Yes.
Yeah, we have a lot of predatory treatment right now, and unexpected consequences of changes in reimbursement structure suddenly we've been seeing the results of that, where people are having a really hard time getting the treatment that they need because of that. So more things for us to work on for sure.
Well, I'll be coming to you to vet things, so try.
Okay, that would be awesome.
And I think what I thought you were going to say, Sharon, is to advocate for connection to employment, right? Because ultimately, and I don't think I said this at the beginning, but when I first came to Kentucky, I heard Tim Robinson from Addiction Recovery Care talk about its model that added a fourth leg to the three-legged stool. And the three-legged stool was mind, body, and spirit in recovery. and they added occupation. And this was like in 2012, I heard him talking about this. And it was such a I won't say transformational again. It was such a moment for me, right? Because to me, the way I thought about it after that was a table with 4 legs is sturdier than a 3-legged stool. And so how do we like add that back in the healing communities, right? That's why we're here. In legislation like recovery-friendly communities, how do we give that purpose or that promise to the community or the person that this might represent in all the work that we're all doing? So that's and I'm biased, like I'm a workforce person. So of course I think every problem could be solved that way, but I think we have a moment in time where that might actually be true.
Yeah, no, I agree with you. And I wasn't omitting that because I assumed that it was implicit in what Beth was describing, but she kind of skipped over the treatment part very quickly as kind of that pathway. And we all need purpose, right? I mean, it doesn't mean that everybody needs to work, because not everybody does need to work if you've got someone else helping with your household and things like that, but we all need purpose. And I think that that's a big part of the definition of what recovery is, right? Is finding that purpose again. And so we have so many initiatives that are underway, and it's really so great to have so many partners across different sectors working towards the same goals to improve the health and well-being of the people in this state. As someone mentioned at the start of this, our overdose numbers, just came out yesterday from the CDC. It's not getting better, it's getting worse because of the fentanyl problem. And it has been urgent for us for a long time. I mean, it is as urgent as ever. We're really just losing so many people. So there's a lot of work to be done, but we need to get everybody activated. So with that, I think we've got like a little closing business. So I really want to thank our 4 panelists. You've been really terrific. It's been so informative. It's been really great to hear about the work that's going on at the state, but also really to hear from Holly and Susan about their own personal perspectives and what they're doing in their own communities and how they're transforming lives. I'm just so grateful to all of you for participating today, and to our audience for sticking with us through the end. I know that all the different resources that were talked about, if you didn't get a chance to write them down, Lisa is the contact for the learning collaboratives. She will pull all those new things together that we may not have had in a list beforehand to be able to share if you're interested. And I'm going to throw it back to Lisa to make some closing remarks.
Okay, thank you, Sharon. In the, you just put in the chat box here, let's enter, there you go, is the links for obtaining your CE credits. See, if you go to this website here,